Good evening to all the viewers who are watching live and will be watching this in the recorded version. So it's me, Medigo Mukherjee, with you, and a bit of little words talk, a bit of a little chit chat is that mm please we are having very few subscribers on Telegram, so do join the Telegram to get more updates. So again with this and one more update, we are not just getting any. Today we are not announcing any winners. So those who have submitted and corrected the correct answer, congratulations to them. I'm not mentioning the name because it will be against our rules. So this was it, a brief words before starting the CME. So without wasting any more time, let's just jump to the 30 seconds countdown time.
Good evening, sir, and good evening,
Good
all the
evening.
viewers across the globe. And tonight we are having our 44th online continued medical education program being organized by National Institute of Homeopathy Alumni Association. Tonight we'll be having our inaugurator, our alumnus from Sri Lanka. With your permission, sir, may I request, sir?
Sure.
May I request Dr. Kaushalya Dilmini to be on the screen and inaugurate tonight's CME.
Sure. Please, Kaushalya.
Thank you, Doctor. Thank you, Dr. Kalyani. Good evening to everybody. It's honor to be the inaugurator of 44th Continuing Medical Education online platform, and I'm grateful to Dr. Bidyut Mukherjee for inviting me to be the inaugurator of today's session. And at the same time, I make this opportunity to thank Government of India as well as Sri Lanka for choosing me as a scholarship student to study homeopathy system of medicine, the most prestigious university for homeopathy in National Institute for Homeopathy, Calcutta. First, I'll introduce myself, Dr. Dilmini Kaushalya Gamage, the Sri Lankan of 22nd batch BHMS in National Institute of Homeopathy, Calcutta. And I've done MSc in Applied Epidemiology in Postgraduate Institute of Science, University of Peradeniya, Sri Lanka. And currently I'm working as a medical officer in charge of Government Homeopathic Medical Clinic, Galle, Southern Province, Sri Lanka. So I'll go straight to the today's speakers to introduce yourself. Today we have Dr. Debajyoti Saha as our distinguished speaker. He is currently working as medical officer of Government of Tripura and guest lecturer of Regional Institute of Pharmaceutical Science and Technology, Agartala. And he has done his BHMS from National Institute of Homeopathy and 11th batch, and he has done his MD in Mater Medica from 9th batch of NIH. And today he is going to speak about the homeopathic approach of allergic diseases. And also today, as our distinguished speaker, we have Dr. Partha Pratim Pal, who was a very outstanding student in his student career. And actually, he has studied BHMS in Calcutta Homeopathic Medical College and Hospital in West Bengal University of Health Sciences in the first batch, and he was second in university in their last exam, and he has won 5 honors in total in his career, 2 times in Mater Medica, 1 time in surgery, 1 time in medicine, and 1 time in community medicine. And also he has done his MD in homeopathy in Department of Practice of Medicine from 13th batch of National Institute of Homeopathy, and also he stood in NIH and MD for final exam, first place in NIH. And currently he's working as a research officer and scientist at Central Council for Research in Homeopathy. Um, and also Dr. Anjali Chatterjee Regional Institute, Calcutta. Today he will be speak about alopecia areata. Also, today in this 44th CME session, our moderator was Dr. Professor Shakhawat Hossain, and he has completed his BHMS in Midnapur Homeopathic Medical College, and he has done his MD in homeopathy from NIH, second batch. Currently, he is working as professor and head of Department of Medicare Medica in D&A Homeopathic Medical College and Hospital. So these are our today's speakers and moderator. I welcome all these distinguished speakers and moderator of today's session, and I wish this virtual platform will help in enhancing and updating our knowledge as homeopaths, and thus we can contribute more effectively in suffering humanity. And at last, I again thankful for giving me this opportunity to uh, be the inaugurator of today's session. And I'm handing over this session to our moderator, Dr. Professor Shakhawat Hossain, to continue the program. Over to you, sir.
Thank you, Dr. Dilmini Kaushalya, Medical Officer in charge, Government of Homeopathic Medical Center, Galle, Sri Lanka. Good evening to other speaker, namely Dr. Debajyoti Saha, Medical Officer, Government of Tripura. He is also a guest lecturer at Regional Institute of Pharmaceutical Science and Technology, Agartala, Tripura. He will give a view on homeopathic approach in allergic diseases. Now it is a burning problem in this era, or we may call it an epidemic. We are living in this era where the allergy is alarming things. We the homeopathic physicians are facing different type of manifestation of allergy. And next speaker, Dr. Partha Pratim Pal, Research Officer, Homeopathy, Dr. Anjali Chatterjee Regional Research Institute, Kolkata, under CCRH, Ministry of Ayush, Government of India. He will give a glance overview on Alopecia areata. These two fields, Alopecia areata, it is concerned with the cosmetic value of the people. Most of the people, especially middle age, they are coming to us with some cosmetic values with alopecia areata. How to deal with the case, we will listen from Dr. Partha Pratim Pal. Not wasting the time, I will call Dr. Debajyoti Saha to give a highlight or glance over the allergy. Allergy are our body's reaction to normally harmless substance such as pollen, molds, animal dander, lettuce, certain foods, and insect stings. Allergy symptoms range from mild rash, hives, itchiness, runny nose, watery or red eyes to life-threatening episode. Now there is a term, allergic reaction. It is the way our body responds to the allergen. A chain of events occur that result in an allergic reaction. If we are prone to allergies, the first time we are exposed to a specific allergen, our body responds by producing allergic antibodies, immunoglobulin E. The job of this antibody is to find the allergens and help remove them from our system. As a result, a chemical called histamine is released and causes symptoms of allergy. Different category of allergy we used to get: mild reaction, moderate, and severe. Namely, we get allergy as a hay fever. In our Mathematica, we are getting this term hay fever. Some food allergy, we are getting some food allergy. Some insect bite, drug allergy, atopic dermatitis, and the alarming one is anaphylactic reaction. So now I may call upon Dr. Saha, Dr. Debajyoti Saha, to kingpin to glare his understanding or cognizance to the topic allergic. Please, sir.
Namaskar. Good evening to all of you. First of all, I would like to thank the Alumni Association for inviting me to speak on this platform on such a very important topic. For nowadays, it has become, as sir already said, just like a epidemic, allergic. Every other person is suffering from some kind of allergy. So I'll take few moments to share my PPT. Okay, let's start. So, what is
Sir,
allergy?
please click on the hide button, sir. Right beside the stop sharing one. Sorry to interrupt. Over to
Is
you,
it
sir.
okay now? Is it visible now?
Yes, sir.
Okay. So today our topic is homeopathic approach to allergic diseases. So what is allergy? Allergy is basically response of our immune system to different kind of allergens. What is the main function of our immune system? The main function of our immune system is to destroy all foreign substances which are harmful to our body. So allergy is a state where our immune system becomes overreactive or exaggerated reaction is there uh, for certain kind of antigens which are called allergen. And most of the cases it is seen that those allergens are harmless to most of the person, like egg. In some person, if they consume egg, it produces allergic reaction, but in most of the person it does not cause any problem. So egg here is a allergen. And what actually happens in allergic reaction? Due to this overreaction of immune system, there is production of IgE, one antibody against them, and it causes inflammation of skin, mucous membrane, respiratory system, digestive system, and which is called allergic reaction. Next, we'll see what actually happens in allergic reaction, that is pathophysiology of allergy. Allergic reaction is basically a type 1 hypersensitivity reaction. Here, what happens when our immune system comes in contact with an allergen, it produces IgE, one antibody. It basically produced by T lymphocytes and specifically type 2 helper T cell. Next phase, what they do, this IgE attaches to the receptor of surface of mast cell and basophil, and during first exposure usually there is no symptom, asymptomatic. So at the first exposure to a particular allergen there is no reaction, and this phase is called sensitization of allergy, sensitization of allergen. But later on, whenever this allergen enters our body, there is severe immune reaction we find, and this after this severe immune reaction there is production of certain chemicals, namely histamine, prostaglandin, leukotrienes, etc. And these chemicals causes vasodilatation, increase in vessels permeability, increased mucus secretion, stimulation of sensory nerves, then smooth muscle spasm, and all these together give rise to different kind of allergic symptoms. And what are they? We usually find in allergic rhinitis like sneezing, then nasal discharge, then anosmia or smell reduced, then there is eye irritation is there, and with that there may be lacrimation, congestion of nose, etc. This basically I am talking about allergic rhinitis. Next, I'll talk about what are the different causes actually leading to this kind of allergy. First important cause is environmental cause. With urbanization, there is also increase of air pollution. So we usually find that in urban cities is allergic patients are much more compared to village areas. Again, apart from air pollution, other um, environmental aspects like pollen. During seasonal changes, there is high amount of allergens, especially pollen found in environment. So people suffer from allergic diseases more during those periods. So usually in Western countries, especially in US, apart from normal weather forecast, there is also pollen weather forecast. So people usually protect themselves or prepare themselves to according to them. Next, I'm coming to the genetic cause. It is found in studies. It is found that among the twins, if one twin is suffering from a kind of allergy, there is 70% chance that other twin will suffer from same allergy. Again, it is found that if any of the parents is suffering from some kind of allergy, his children is most likely suffer from that same kind of allergy from same allergen source. It is also found that allergies are more common during childhood, and with increase of age, this tendency usually reduces. Next, different symptoms of allergy. I will categorize them according to system. Actually, symptoms of allergy vary from person to person. It may be mild, moderate to very severe. So the most common kind of allergy is attacked by allergy is respiratory system, and most cases it is due to dust mite, then pollen, animal dander, hair, fungus, mold, and different kind of chemicals. And the symptoms are usually sneezing, rhinitis, cough, fever, itching in throat, and all this together is allergic rhinitis. And in our materia medica, as our professor already said, it is called hay fever. And in severe cases, patient may develop breathing difficulty, and in asthmatic patient, this situation may aggravate their symptom due to bronchospasm. Next, eye symptoms. Usually, with respiratory symptom, usually eye symptom is associated, and eye, it may be there may be itching, redness, watering from eye, dryness in eye, and it's a very common symptom in case of allergy. Next, I'm coming to the skin symptoms, and cause are usually handling different kind of chemicals like latex of tree, which is very common in Tripura because in Tripura rubber cultivation is very popular. Then contact with different kind of metals like zinc, cobalt, nickel, then low quality of plastic items, these easily causes allergy. Symptoms are itching, redness, swelling, which are called urticaria. There may be hives, contact dermatitis may be there, eczema. You can see the pictures that some person was wearing one ring, and after that there is eczema or skin eruption is there. And another picture is there. Some person was wearing on sandal or something like that. After that, she developed this skin problem. Few more symptom of skin allergy. upper left one that he was using one belt, and from that metal allergy developed, and few others picture you can see. Next, most important, and this is food allergy. And in study, it is found that around 20% of people suffer from some kind of food allergy, and these are mostly due to egg, prawn, shellfish, sea fish, crab, tortoise, milk, etc. Among vegetables origin, peanut allergy is very common in Western countries. Apart from that, brinjal, soya, gluten, it's also may cause skin allergy and food allergy. And symptoms are usually it may be cause pain, abdomen, vomiting, loose motion, etc. Along with that, along with food allergy can also cause skin and allergic rhinitis like symptoms. It differs from person to person. Another important allergy is allergy from insects. Different type of insects like honeybee, hornet, spider, ant, and their larvae, etc. If bites or people comes in contact with them, usually cause allergic reaction. And symptoms are usually itching, pain, redness of skin, which are called hive, swelling of skin, called angioedema. There may be urticaria, and in severe cases, even breathlessness may develop. This picture. The left one is angioedema. There is swelling of surrounding tissue, and right one is hives, called hives. Another very important aspect is allergic from drug reaction, especially high doses of or inappropriate dose of allopathic medicine usually cause allergy. Allergy may occur due to drug reaction, which may cause swelling of mouth, tongue, along with that itching, redness, swelling, breathing difficulty, etc. And in drug reaction, in severe cases, may cause anaphylactic reaction. We are coming to that later on. Yes, anaphylactic reaction. This is basically a very severe form of allergic reaction, and um, in this reaction, the chemicals that is histamine, prostaglandin, etc., are produced in very high quantity. As a result of that, what happens? It's a very severe kind of allergy, and it may develop within few immediately or within few minutes to few hours of contact to that specific allergen. Symptoms are mainly found in skin and respiratory system, and there may be difficulty in breathing. And main problematic thing is usually blood pressure goes down very rapidly, and people may lose their consciousness, and this is a life-threatening condition. And if proper medication or proper management is not taken, a patient may die. And in Western countries, peanut is the number one cause, and overall reaction after taking vaccine is the main cause of anaphylactic reaction. So, what are the tests we usually do for to diagnose allergy? The most common test is test for serum IgE. This test is most frequently done and of allergy to identify antibody against a particular allergen in blood. Apart from that, complete blood count, absolute eosinophil count is done to measure the measure the allergy. Another very important test is called skin prick test. In this test, a very small amount of suspected allergen like pollen, peanut, etc., is injected under the skin. And if allergic reaction occurs with itching, inflammation at the prick site, we usually say that that person is actually allergic to that particular allergen. It's very popular test. Another test is called skin patch test. This test is done to know actually contact dermatitis. In this case, suspected allergen is kept in contact with the skin of the back and observed for allergic reaction. So, if suspected allergen causes allergy reaction, we confirm that that person is allergic to that particular. Basically, to identify metal allergy, this test is done. Now, I'm coming to the homeopathic approach. In homeopathy, we know that the constitutional treatment is the best treatment for homeopathy. In constitutional treatment, what we do? We study the whole person, we collect all the physical, mental symptom and all. After that, individualize the person and select the most similar medicine, homeopathic medicine, and this is the best way of treating allergic diseases. But there are few other concepts also, because sometimes it happens, we it is very difficult to get the simillimum. First time when patient comes, we usually do not get sufficient number of symptoms, significant prescribing symptoms. In those cases, we find difficulty, but a patient comes with lot of expectation to the doctors. He needs immediate result, immediate relief of his symptoms. In those cases, we have to shift our, or we can uh, think otherwise. Like classically trained homeopath often prescribe constitutional treatment, okay, but in some, the thing is that there is a conceptual, the one thing I would like to say, the main treatment nowadays in modern science is doing is desensitization treatment. In this treatment, what they do in allopathy, they usually uh, uh, they usually give a very small amount of that particular allergen the person is allergic to. Suppose a person is allergic to peanut. So what they do, um, they inject a very small amount of peanut in the person's body, and usually it is found that that person gradually develops, becomes less sensitive to peanut. This treatment procedure is called allergy desensitization treatment. It is also called immunotherapy in allopathy. So there is lot of similarity in this process and homeopathy. How? I am coming to that. There is a conceptual historical link between homeopathic medicine and modern allergic desensitization treatment or immunotherapy. In conventional allergy desensitization treatment, a very small amount of allergen introduced in allergic person, so person becomes less sensitive to that allergen. On the other hand, in homeopathic treatment, which is basically a nanoparticles of those medicines, is utilized in small doses of substances that might cause symptoms similar to allergy in order to prevent or treat a hypersensitive state. So there is similarities there. Next, we can also uh, follow the isopathic approach to using homeopathic medicine. How? Several clinical studies utilize an isopathic approach to using homeopathic medicine. That is, rather than using a substance as a medicine that it causes similar symptoms as the ill individual. That is, in isopathy, what happens? The same causing factor potentized and given to the disease person. In we can adopt this case when a allergic patient comes, but we do not get sufficient number of symptoms. But in these cases, we if we give a like someone is suffering from dust allergy, in isopathic point of view, if we give house dust, you will get very good result. From my personal experience, I can say that in this kind of cases, if we give medicine specific to that allergen, it acts wonderfully. So, but definitely in by using those medicines, you will not get complete cure, but immediate symptomatic relief you will get, definitely. So there are some important medicine I'd like to mention in treatment of allergic diseases. Arsenic album, as we know, it's a very good medicine for allergic, specifically for allergic rhinitis, and patient is usually chilly patient and now emulated by hot application or anything hot. Ars iodatum basically much better than ars album in case of allergic diseases. It acts more quickly, especially in rhinitis cases when there is a lot of sneezing, running nose, there is a burning sensation around nose and throat area. Arsenic iode works wonderfully well. And whenever you give this specific medicine, always give in lower potency, 630. Then Ilium cepa, as we all know, is a very good medicine for allergic rhinitis. And when the nasal discharge is thin and lacrimation is thick, euphrasia is very good medicine, just opposite symptom of Ilium cepa. Histaminum, I have found this medicine is very good in giving quick relief to the patient, those allergic reactions. Histaminum, whenever you comes with allergic symptoms, but apart from allergic symptoms, you are not getting any good constitutional symptom, substantial amount of constitutional symptom, then go for histaminum. Definitely you'll get some result. Avena sativa. If someone having allergy from oats, this medicine works very well. And it is also in boric, it is written that in case of allergic rhinitis, you give 20-30 drops um, in water and repeat. It gives very good result. Dulcamara, allergic rhinitis, then allergic urticaria, especially in cold and rainy weather, Dulcamara works very well. And special thing is this in case of Dulcamara, this allergic urticaria and all are relieved by cold application. Blata orientalis is very good in case of allergic rhinitis and respiratory allergy leading to breathlessness. And if in any case is some person having allergic to cockroach, you can give Blata orientalis. It works very well. Next, Artica urens. Artica urens is I usually use in mother tincture form, and in any kind of all kind of allergy, you give Artica urens mother tincture 20 drops thrice or 4 times in a day. You will definitely get result within few hours. Solidago. Solidago is a very good medicine in case of pollen related allergy. If some person says that always I am suffering from, I always suffer from allergy whenever there is weather change, especially during when the weather change from winter to summer, that is total dry weather. The weather at present is a weather of Solidago. Then, as I have already said, house dust mite is a very good medicine. Then pothos. Pothos is a very good medicine for dust-related allergy. Cassia sophera. Cassia sophera, I usually use this in mother tincture form, and it is very effective in rhinitis. Whenever there is excessive sneezing and running nose, gives of Cassia sophera mother tincture in warm water. It gives wonderful result. Then Rasven, this is basically for skin related allergy, when the skin allergy, itching, etc. is relieved by hot application. Rasven is very good, and Fagopyron is just opposite. It is relieved by cold application. There are many more medicines like that, but as I have said initially, that constitutional treatment is the best treatment in allergic uh, diseases. But you have to think beyond that also. You have to know few specific medicine also, which will give quick relief to the patient. When patient gets relieved, then you give more time to the patient, get more constitutional symptom, and come to a simillimum. So, in conclusion, homeopathy appears to offer possible option to conventional treatment of respiratory allergies and other allergies. Homeopathic doses of specific allergens or individually selected homeopathic constitutional medicines have been shown to be effective in the treatment of various respiratory allergies, including patients suffering from hay fever, allergic rhinitis, and asthma. So I hope um, from this lecture, if anybody gets any help, I'll be very thankful. Thank you all again for your patience hearing. Thank you.
Thank you, Dr. Debajyoti Saha, Medical Officer, Government of Tripura, for enlightening us on the subject said above. He also creates some avenue to ask, or we may get something from Dr. Saha. I will ask him about the potency. House dust might, in which potency it will act better, but this session will come at the end. Now, I may call upon to the kingpin to share the knowledge about the Alopecia areata from Dr. Partha Pratim Pal, Research Officer, Dr. Anjali Chatterjee, Regional Research Institute, Kolkata. We know about the alopecia. Alopecia areata is a common autoimmune disorder that often results in unpredictable hair loss. It is a non-scarring alopecia caused by T-cell mediated autoimmune destructions of a hair follicle. The general population has an approximately 2% risk to develop alopecia at any time of their life. It is the majority of cases hair falls out in small patches around the size of a quarter. For most people, the hair loss is nothing more than a few patches, though in some cases it is more extreme. Sometimes it can lead to the complete loss of hair on the scalp, or in extreme cases, loss of hair on entire body. Condition can affect anyone regardless of age and gender, though most cases occur before the age of 30. There is a little scientific evidence that alopecia areata is caused by stress. There is no cure of alopecia areata as conventionally said. Hair loss, also called alopecia, can occur in any part of the body. Hair grows in cycle. Each cycle consists of a long growing phase, 2 to 6 years, a brief transitional phase lasting 3 weeks, and a short resting phase for 2 to 3 months. And it is astonishing to say that every day we are losing 50 to 100 scalp hair, but it is unknowingly happening. We are not aware of that. We want to know the details about this alopecia from Dr. Partha Pratim Pal. Now, I may call upon the kingpin, Dr. Partha Pratim Pal, to share his views and give us some enlightenment. Thank you very much.
Thank you, sir.
Thank you very much for giving me the opportunity, and thanks also to NIH Alumni Association for giving an opportunity to speak on this platform. And really, it was a wonderful platform to share, exchange, and increase your knowledge. And this is a wonderful initiative taken by LIH Alumni. So it's a great it's a great thing, I should say. It's a wonderful platform for everybody to join, and I would like to invite others also who are belonging to the homeopathy fraternity. That if possible, if you get an opportunity, please do and come in this platform and and make this platform a success in future. So with this, I would like to start my presentation, which is on alopecia. And as Sakhawat sir said, rightly so, that alopecia is basically having a cosmetic value. And why I am speaking this, why I have chosen this topic today, I will tell you once I start with my presentation. So I'm trying to share the slides. Slide.
Sir, your screen is being shared, sir. Sir, your screen
Shared.
is being sharing. Yes, sir.
Okay,
There is no
okay.
problem
So
with that. Just click on the PPT now.
just click on the slide. Okay, fine.
Yes, sir.
Is it okay now? So is it the is the slide visible? Full slide?
Yes, sir. It's fully
Okay.
visible.
Okay. So alopecia areata, and I'm Dr. Partha. An introduction has already been given. So why alopecia areata today? Because we are in the middle, not exactly in the middle of the pandemic, but exactly don't know in which stage of the pandemic we are in. As per the data which is concerned, probably we may be in the quite at the termination of the pandemic, or we may exactly cannot predict in which phase of the pandemic we are in. But at present, it's a better situation, at least when compared to the last 2 years when we started with the COVID pandemic in 2019, and ultimately in 2020 in India when we started with the pandemic. So after that, so many things have come and gone by, and one of the important thing which have restricted the pandemic to its progression is obviously vaccination. And as you know that every positive things also come with some negative effects. So vaccination also is not an exception in that. And this alopecia areata is one of the complications which we are finding in our clinics nowadays daily after the SARS-CoV-2 vaccination. And to support this, it's not my saying, but my observation, which has been supported by this publication, which is a very recent publication. It's February 2022. We can see it's just a 1 month ago, a publication has been published in a reputed peer-reviewed journal, which says that this alopecia areata, we know, as Sir also said, Sakhawat sir just said, that it's a T lymphocyte-mediated autoimmune condition, and rightly, alopecia areata, a COVID, is also related with T lymphocytes. I'm not going into the COVID and its detail, but this much knowledge we who are the sufferers of the pandemic know by this time now. So this alopecia areata is a T lymphocyte mediated autoimmune condition as well, which is characterized by hair loss and due to the inflammatory response targeting the hair follicle. And these recent reports have suggested that COVID-19 may trigger a variety of autoimmune conditions, and which one such is obviously our topic of today, that is alopecia areata. And in this publication, actually they have highlighted 9 cases which you can go through, which is an open access journal, and this is the reference for that. So with this, I begin. And before going into exactly alopecia areata, just have a little bit of glance about what is alopecia and what may be the other types. Alopecia overall just means simply that it's a loss of hair, and it may be categorized into two categories. One is psychiatrical alopecia, another is non-psychiatrical alopecia. In psychiatrical alopecia, you can understand from the term itself that there will be scarring present, and hair follicles obviously will be destroyed, and so it's quite an irreversible kind of situation. You don't think, or you should not promise that every patient who comes with baldness that, well, homeopathy will do it for you, and whatever loss you have on your hair, on your scalp, I will recover it. It may not be always, because if it's especially a psychiatrical type of alopecia, don't promise or don't give false appreciation to false hope to the patient that you will do with your medicines. So you should see what type of case you are getting in the clinic, and then accordingly you should respond. And that's why the allied part is very important every time. And you should know that in a psychiatrical alopecia, the skin should look shiny and the follicular openings are totally absent. And the signs of inflammation will be visible either in time sorry, either in form of papules, pustules, scaling, or hyperpigmentation. And one such example is pseudopelade. Pseudopelade, what is pseudopelade? If you go through internet, definitely you will find. But for my from my point of view, it is simply a self-limiting hair fall, which actually occurs with age, and it actually it's occurring with age, and it is quite progressive, and this is often self-limiting. But this kind of situation occurs in patient now and then, and as sir also tell, we are aware of the daily loss of the hair, which is actually occurring every day. And pseudopelade is something when this hair fall becomes when it comes to your notice, and then you actually try to think about consulting a doctor. But this might happen in any patient with the age and with the progression of the life. So this is something which is irreversible, and you should not try to cure this kind of situation with medicine, because they are beyond cure. Next, the non-psychiatrical alopecia. These are often presented with not present with scarring. The hair follicles are not destroyed, and since the hair follicles are not destroyed, they are reversible. Follicular openings are visible, and you can see the when you will be able to see when I will show you the pictures that they are basically absent. Means the signs of inflammation, they are basically absent. And out of the non-psychiatrical alopecias, alopecia areata is a very popular one, which we will be talking about. This is the broader classification with examples. You can see the non-psychiatrical type. It may be localized or it may be generalized. Alopecia areata is one such. We will do the details of this. This is the topic of today. Next, otherwise, it may be some kind of other localized alopecia. For example, androgenetic alopecia. Androgenetic alopecia is something which happens basically in the females along a definitive pattern of their head. It doesn't have a receding hairline, which is more popular in the males. And in the females, this androgenic alopecia generally occurs in the terminal part of the scalp, and this basically presenting with the terminal hair loss. Traction alopecia. This is something which is often seen in people who are used to bind the hair very tightly. For example, if they're in such a profession where they have to make makeovers of a hairs now and then or every day due to the demand of the profession, and in that way they are constantly pulling the hair, and in that way ultimately it can lead to traction alopecia. So which is mostly occupational due to the situation. Tinea capitis, we are well about this, that this is a fungal infection, and if it affects the scalp, then it might lead to hair loss as well. But it definitely has its own tinea-like features, which I'm not going to repeat. You know it, and that will be quite evident to make a differential diagnosis with other alopecias. Next, generalized alopecia universalis. Alopecia universalis is something when you have a hair loss all over the body. Means it's not only confined to scalp. There will be hair loss from any other parts. Means your pubic hairs, axillary hairs, or maybe hair from any other portion. There will be a loss. Means just like what we studied in your drug selenium, where it explains that there is a loss of hair from every part of the body. So that is alopecia universalis, and please don't confuse with alopecia totalis. Alopecia totalis actually refers to the total loss of the hair from the scalp. I will show you just in the next slides. And alopecia totalis is not as same as alopecia universalis. The terms are different. The meanings are also different. Next, ectodermal dysplasia. Ectodermal dysplasia is actually a problem of, it's not a single problem of hair, but it's actually a group of condition in which there is an abnormal development. It's a developmental problem, and the developmental problem related to those structures which actually arises from ectoderm. For example, it's not only the hair. There will be problems related to the skin, to the nails, to the teeth, or even the sweat glands. Means the parts which have a ectodermal origin, because we know development generally occurs from three layers: ectoderm, mesoderm, and endoderm. So the ectodermal origin tissues and the cells will have problems, as I said. Shaft abnormalities, as you know, it's the hair follicles have a shaft, and that shaft abnormalities can also lead to non-psychiatrical alopecias. Now, the psychiatrical alopecias, it congenital, it will be alopecia cutis. It is right something which is a problem right from the birth, and it's beyond recovery. Inflammatory, lichen planopilaris. Lichen planopilaris is something, is some form of lichen planus actually, which affects the skin and the scalp. And discoid lupus erythematosus, which is our SLE. When SLE occurs, there it's also an autoimmune condition, as we all know. It also affects the body. It's a multisystemic disorder, also affecting the skin as well as the hair. And there is alopecia, which is of cytrical type. Infective F1 and carrion. These are actually different forms of pustular folliculitis, which occurs in the hair follicles. So this may be due to any kind of infection, either bacterial or fungal or maybe viral. So carrion and favus, most of the time it's basically of bacterial or fungal origin. Nevus sebaceous, this may be another reason for psychiatrical alopecia. Traumatic, maybe physical or chemical. Neoplastic, basal cell carcinoma. We know, we are quite well aware about the basal cell carcinoma location. It's basically in the face, and it can take over on the scalp as well. And idiopathic, pseudobilady of Brock, which I just explained, which will be occurring as per the aging. Now, the basic topic and the right on the topic, that is alopecia areata. It's an autoimmune disorder, and this is the main key for alopecia areata, that you should remember that it's an autoimmune disorder. Because whenever you get encounter an alopecia areata, don't think that it is something of infective origin, which we often tends to think that it might be of some fungal origin or maybe of bacterial origin, but most often it is of autoimmune origin. And very often you might find this alopecia areata with some other autoimmune features in the body. Generally, it is characterized by transient non-scarring, which is non-psychiatrical hair loss with preservation of the hair follicle, and that's why it is actually reversible. Next, there is small annular or patchy bald lesion that can progress to the total loss of the hair, which I told you, alopecia totalis, or maybe a total loss of all the body hair, that is alopecia universalis. And this is the characteristic clinical diagnostic point for this alopecia areata, that is this exclamation mark here. If you see the next slide, you will be quite able to understand. You have seen it probably much earlier also, you might have seen it, that the area, that particular area where there is a loss of the hair almost looks like this, which is resembling a exclamation mark. Means the center is totally clean, as if like a clean shaved area, and the periphery just have very short and long hairs, which appears like a exclamation sign. Since the hair follicles are preserved, that appears along with those preserved short and long hairs, which appears as an exclamation mark. And that is the characteristic diagnostic point for this alopecia areata. Next, what are the factors which might give rise to this condition? So, genetic predisposition, immunological factors due to inappropriate immune response to hair follicle associated antigens, which is variable and it may be many. Emotional factors, which may be associated with anxiety and depression. Association, as I am telling you, mostly the association which you will look for is basically in the nails. You look for some oncolysis in the nails, or maybe some atrophy or some other autoimmune disorders. It can start at any age, and it appears to increase with age also. Both males and females are equally affected, and incidence of alopecia areata is approximately 2%. This is a figure which actually shows the phase of the different hair, development of the hair follicle. And before I explain you this picture, you see this slide, I think that will be more understandable. So the first line which says like this, that inflammatory cells that attacks the hair follicle matrix epithelium. which moves into the catagen phase. So if you see the hair follicle, my mouse cursor, if you just see that anagen 1, 2, and then they ultimately enter into the 3, 4, and then this is a telogen, and this cycle actually reverses. And if you see this anagen 4 phase, this is the ultimate phase you need to reach. And this is the complete on the left hand side, this anagen 6 which you have. This is the complete developmental hair which has occurred with the sebaceous gland, with the bulb of the hair follicle and the shaft. Everything is okay, but this actually involves a epithelial column which is at the base of the hair follicle. And now if that is regressing, you can see the regressing epithelial column, and if that is regressing, then gradually that may be the reason for such alopecia. And this is actually what is happening when the regressing epithelial column ultimately lands up in the loss of the hair. So you can see what is that. I have exactly written it here, that there occurs no destruction of the hair follicle. There is no destruction of the hair follicle in the stem cell, and hence they have the power to retain, to regenerate, and continue the cycling. The basic problem is the regression of the epithelium, and hence the hair is not formed. So follicles ultimately re-enter the anagen phase normally, but they do not develop beyond the anagen 3 or the 4 phase. They need to get into the anagen 6 phase, but they get arrested to the 3 and 4 phase just because of the regression of the epithelial column. That's the basic reason, or the pathogenesis of the alopecia areata. Okay, next, the course of the alopecia areata is not predictable. Single lesion usually recover within a few months. Regrowth begins at the center of the lesion, and initially the new hair which is developing is very fine and maybe gray at times, but gradually it regains the normal thickness and the color. And in elderly, the regrown hair may remain gray. Now, there are different types. This is something which is very popularly found in the clinics, that patchy alopecia areata, multiple patches of hair loss. Then alopecia totalis, which I was telling you, there is a complete loss of hair on the scalp. Alopecia universalis, alopecia of the whole body, loss of the hair from many parts or every parts of the body. Alopecia incognita, where the acute diffuse shedding of the telogen hairs occurs, but without any typical patches. There is loss, but there is no particular patches. There is a loss from all parts, but without any particular recognized severe patch. Ophiasis, you can see that there is a clean cut loss of hair, which is just in the superior auricular area. You can see it in the figure. This appears actually in the band in the areas from the top of the ear down. So it is, which is occurring in the periphery. So when the loss is around in the periphery of the scalp, it is basically ophiasis. The opposite of that is C-SIFO. C-SIFO is opposite to ophiasis, which is leaving the periphery of the scalp. So when you leave the periphery and you affect the center, then it is CFO, and opposite of ophiasis, you can say. Marie-Antoine syndrome, it is actually where you have a loss of hair, means patches of loss, along with the hair suddenly turning white. This is one just type of alopecia, and this is certain association. The pitting, disfigurement, loss of function of the nails is oncolysis also, means you can see the breaking down of the nails becoming brittle, which is covered by many of our drugs, anti-improved, silesia, etc. So there are many other drugs, not getting into it, but this disfigurement of the nails, this loss of function of the nails, this oncolysis, I think this is something which to be looked for when you actually see a case of alopecia areata, because you might think that alopecia areata is a one-sided disease, only coming with a patchy loss of hair on the scalp at some point of time, at some point of location, but there are certain other features you need to examine. Now, differential diagnosis, as initially I was telling you, if it is Tinea Capitis, then definitely there will be some scaling and inflammation prominent, which is absent in alopecia areata. The condition of the hair in tinea will be hair remaining in patch, and it will be lusterless and easily pluckable. and alopecia areata, that exclamation mark sign, which I explained in the slide, that is what you should look for. And Sacral Alopecia and Alopecia areata, it's already explained that in terms of hair follicle, it will be reversible for psychiatrical, but alopecia areata, it will be reversible. The skin will be shiny and follicular. Openings will be absent in psychiatrical, but it will be visible in case of alopecia areata. Signs of inflammation present in psychiatrical, but absent in alopecia areata, and the other associated features. Especially, it will be lichen planus and SLE if it is psychiatrical. The other features, but it will be the nails if it is alopecia areata, in terms of other features when you are looking for. The conventional treatment, generally corticosteroids is used, or immunosuppressive drugs. As you know, since it's an autoimmune disorder which also is dealing with T lymphocytes, so definitely you will use some immunosuppressive drugs. Means, as per the conventional treatment is concerned, I am highlighting that. So local steroid injections generally is also used, and although all these induce hair growth, but their long-term use is contraindicated due to undesirable side effects. These things we know. And one more thing is also very much practiced in locals, or maybe very much popular in the remote areas, that many people used to use onion juice, or the onion parts of the onion directly on that part of the hair loss, or that patchy area of the hair loss, for the regrowth of the hair. Now, this thing has some scientific evidence, which is shown in this next slide, that whether this onion juice is really able to cure alopecia or cure the baldness. Now, this study which has been done, which you can see, is published in a reputed dermatological journal, which has taken actually a topical crude onion juice on one part, and the other part was dealing with simple tap water. And in the first group, there were 23 patients, and in the second group, there was actually 15 patients who were dealing with or getting treated with tap water just. So ultimate conclusion was found favorable for the onion juice. So you cannot actually say that onion juice topical application is useless, and because this scientific evidence is there, and clinically also, very often many people used to say that they have been finding benefits from the topical use of this onion juice. And nowadays, you will see many hair shampoos are also using onion as a component of their shampoos or hair oils. So onion definitely has some, beneficial effect for the growth of the hair. At least the scientific evidence is there for that. When concerned with homeopathy and alopecia areata, I have been publishing. I have gone through the publication which has been available over the internet and the different journals, and I have been able to found three such case reports only. No trials has been found. This is the point to be noted. I found no trials on clinical trial on alopecia areata till now, but three case reports were available. So you can see one such case report was dealing with alopecia areata, and it was published. It was individualized treatment of homeopathy was done, and it was seen that some medicine, means individualized medicine. It's not that any specific medicine was used. So individual medicine was able to cure this alopecia areata. And another one which was published in IGRH, it was for a 11-year-old boy. It was evidence-based publication which was supported with photographs. If you go through the publication, you will find. And the drug which ultimately proved to be beneficial was lycopodium, which was based on the prescription was based on the totality. And another one which was in homeolinks, that was also a case report, and that it was also for a 19 years old female, unmarried female, where the treatment was again constitutionally done using the medicine graphitis. So one thing was evident from the case reports, that alopecia areata was responding to individualized constitutional homeopathic medicines. And if you go through the therapeutics which is available from our homeopathic literature, this is what I have collected you for. That is alumina falling out of the hair, which have the scabs to each and is basically numb. Arsenic album also again have application in alopecia areata. The circular patches of hair, bare spots, hair becomes gray early and aggression occurring at night and with the sensitiveness of the scalp. Fluoric acid also have alopecia areata where the hair is very much brittle and the hair fall is basically after fever and destructiveness is the keynote. Graphitis, hair is matted, brittle or falling hair, was from vertex and the sides. Calicarp, hair falls out from the eyebrows, temples, and the beard. Lycopodium clavatum, hair falls becomes gray early. Premature baldness after abdominal affections, childbirth. Mesothelium, hair falls in the handfuls. Natramure, hair falling after parturition. Nitric acid, falling of the hair from the vertex, scalp is also sensitive. Phosphorus, falling of the hair in large bunches in spots. Phosphoric acid, hair falls after grief or loss of fluids. Selenium, pain in the scalp as if hair were pulled out. Hair falls out from the eyebrows, whiskers, and genitals. Sepia, hair falls out after chronic headache at menopause. Root of hair is very much sensitive. Syphilinum simply talks about the falling of the hair without any particular additional feature. Helium also has a hair fall with great rapidity, and Vinca minor hair falls out and is replaced by gray hair, which is, I told you, one of the feature of this alopecia areata. Initially, they may replace with thinning and graying of the hair, and gradually may gain the color. But initially, it might be gray. So Vinca minor is one such drug you can think about in that situation. So whatever may be the particular drug, the very important things area of selection should be as per the generalities, as per the totality of the case. It's not only just this one line symptom is enough for the prescription of syphilinum or sepia or nitric acid or whatever may be the drug. The generality should match, and obviously that should go with this particular symptoms as well. And only after that the prescription should be made, and then only we can call it as to be an individualized constitutional homeopathy. So with this, as I should say that every presentation is never completed unless you have a case presentation or a case supporting presentation with your documentation. So I have supported this matter of alopecia with a case report, and very quickly I will go through this case report. And this case is quite an interesting one because I will tell you gradually. I will open up why it's interesting. It's a female patient, SK, 31 years, presented, visited OPD of our clinic only in 31/10/2020 with localized, well-demarcated patches of hair loss, which you can see from the pictures that on the vertex, especially around the parietal lines, the hair loss have started. And another one such patch is also available in the occipital area. This has just developed, 1 month has just gone, and it was progressing circumferentially. Now, what is important for this particular case, that this was actually a patient who was suffering from warts. He was suffering from warts. You can see this. You can see her face. She was suffering from multiple warts, which was basically a very small fleshy type of warts, and found over the nose and rest of the face also, below the eyes you can see, and even below the lips. There were multiple numerous warts. Total, if I count, it was around 10 to 12 such warty lesions which was on the face. And uh, you can see that after treatment she was cleared with the warty lesions. Now this warty lesions took almost 1 year to get recovered, I mean to get totally annihilated. As I'm showing you the date, that is 31/10/2020. This is actually the complaint of alopecia which she comes with. But 1 year before, in the 2019 December, she came with these complications, and these complications ultimately was treated with a drug, which I'm coming to it, with a drug, and this took almost 12 months for this patient to recover with causticum. And why causticum? I am coming to this. So for 12 months, she was under the treatment of the warts, and she was cured with causticum. And the basis of causticum selection was this case history. Yeah, past history. She already had a similar episode of this kind of alopecia, but at the age of 15 years, and as per her memory, she received at that time certain injection. As I told you, as per of the conventional treatment, there are steroid injections which are given to the patient. So probably it might be one of those which she got at that time, and then gradually she recovered. Pneumonia also occurred during her childhood. Family history: her father was suffering from diabetes mellitus, and she is married and stays with her husband, and also father stays with him, and also have a child of 4 years. But unfortunately, that child is suffering from a gross motor developmental disorder, due to which she is very much depressed and very much anxious about her child. So physical generals, ectomorphic generally, its weight is around 48 kgs, height 152 centimeter. Appetite is she was having a ravenous hunger, constantly feels hungry even after meals. Thirst was extreme thirst, around 4 to 5 liters per day. Desire aversion, nothing particular could have been elicited. Intolerance also, nothing as such came out. Stool, there was a one important point that she used to have urging early in the morning, as soon as rising from the bed, and after breakfast again urging comes for defecation. So this was a type of pattern of urging which she said particularly. Urine, there was some burning sensation, but when that occurs usually when she was not been able to drink water because of his duty schedule. So perspiration, dryness of the skin generally, sweating was much less, and as per thermal reaction, she was very much a chilly patient. So patient was very much, as per the mental generals, patient was very much anxious about his son, and who was actually suffering from motor dyspepsia, as I told you, and constantly is in a state of fear for his future. For last few years, she is in a state of depression regarding this issue, because she was thinking that one day somehow his child would be able to walk by his own. But even now, still the child is suffering from that motor dyspepsia and is not been able to walk properly without support. So he's very much depressed and anxious about this situation, and very much worried about the future. And other side of his, she's very much sympathetic, and is always worried about the welfare of the others. So on the analysis of the case, these were the symptoms which I ultimately took: an anxiety about the future of her son, the sadness and the depression due to gross motor disability of her son. She is sympathetic in nature, having a ravenous appetite, extreme thirst, and urging for stool on rising in morning, and urging for stool on rising in morning, and even after breakfast again the urging develops. If you see Ken reported, there was only one drug for that, that is basically aloe. But again, we don't prescribe on a particular symptom, and particular symptomatology prescription is not the proper homeopathy. So aloe, based on this, we cannot prescribe. We have to look for the totality, and the totality goes with all these symptoms. And even since it was for warts, so the warts was also taken into account. It was multiple over face around the neck and small and fleshy, and this was the repertory. And causticum, as you can see, is far, far away from the next drug and rightly indicated. So causticum was given, and based on the symptomatology and the repertory analysis, and obviously after final decision from Materia Medica, causticum was the medicine. The patient, as I told you, came actually in the July of 2019, and she already had a history of cauterization of vatilations also 4 years ago. So causticum was started with 60 potency, TDS 3 days, and was placebo for 2 weeks. And gradually treatment continued, and finally in 2020, when in the month of March, when causticum 1M came, means I gradually proceeded after 630, 200, and 1M was prescribed on that time, March 2020. 2 doses was given. After 1M, there was some remarkable decrease in the size, and within 4 months of 1M prescription, after that prescription, it was basically placebo, placebo, and placebo after the for the next 3-4 months. And in July 2020, the face was almost clear, as I told you. So the situation was this, and it became this. So Posticum was the clear-cut prescription, and it cured the case basically. But now this same patient came after 3 months with alopecia areata. Now, just for all of our knowledge, I'm just adding, which we all know, that these warts are basically resultant of a human papilloma virus infection. And alopecia areata is basically an autoimmune disorder. This thing we know. Forgot to highlight one paper, but based on that paper, I am saying this alopecia areata may also get triggered after some viral affection. There is evidence from some paper which I went through. There and based on that, I can make up, I can tally this observation that why after 3 months this thing happened. So this one such paper which I found when I came through supported this situation which I was facing through. So 3 months after, the patient developed alopecia areata, and in October 2020 he came, and since it was already 3 months, I just decided to go with the same drug, obviously, because it was the same person and without much variation in the case taking, I found it is almost the same. And so I just went with one dose of causticum 1 m. But what happened is in front of you. Surprisingly, the hair fall kept on increasing. You can see from the first figure. If you compare this figure, it is very much increased, and the balance was increasing. Patient was, but still I decided to just have a observation for 1 more month and see what happens. So I didn't change the drug. I didn't increase the dose. I just went with placebo for 1 more month. But patient came to me with this follow-up after 2 months. So I just went for placebo for 1 more month. In the second follow-up, I was more shocked because the hair fall was keeping on increasing. It was deteriorating, and hair was becoming much thin, and hair was now coming out in bunches. It was easily, before she was telling that while combing the hair was coming out in bunches. Now she was telling that when he just simply pulling it and it is coming out. So this was really a fearful situation, and I was a bit really worried what to do now. So now I thought of change of some prescription. I thought of not going into causticum. So I just changed the prescription to carcinosin 1 m. So there may be a question which might be arising to your mind that why didn't I go for a higher dose of causticum 10 m? One of the reason is just because causticum 1 m I prescribed, but somehow the condition as it was deteriorating, I didn't have the guts to go with the higher potency of the same drug. So I thought of changing the drug. And why carcinosin? I am going with the next slide. Why I decided to go for carcinosin. Again, 2 doses of carcinosin, which was followed by placebo. And I chose carcinosin because of these 3-4 factors, which was with the patient already. And just I'm yeah, giving you the details why. Carcinosin is a deep-acting remedy, this we all know. And it's quite an anti-miasmatic remedy and often used as an intercurrent, especially in cases where the progress has been suddenly stopped, and where the constitutional remedy has failed to show its effect. So this was a classical situation which was matching with my situation. So I thought, why not use the intercurrent carcinosin? Moreover, patient had some symptomological similarity. For example, the carcinosin patient was very much sympathetic and compassionate, and this patient, as I told you, he was very much sympathetic. She's so much sympathetic. She was that at times she doesn't demand anything for them himself, and he actually feels the pain and intensely suffering of the others, and very often forget about his own problems, and very much concerned about the problems of his father, of his parent, of his son, of his husband, or relatives. Her problems he tends to forget very often. So that sympathetic and compassionate nature was very much evident in her. And the next point was more interesting. There was sadness in her, but that sadness was never associated with weeping. This was very much what I found in her. She used to repent about her situation, used to tell about her condition, but not a single day she was seen to weep in front of me or even of her family. Because from her husband or from her father also, I came to know that she was not a person who used to weep or cry. So there was sadness, but weeping wasn't there. So he could silently keep her grief with her. So that was one of the important characteristic which made me to go for carcinosin. And definitely another fourth point, which obviously Dr. Forbister has highlighted in his Medica of carcinosin, that warts has been repeatedly cured by carcinosin, especially on the lips, on abdominal skin, on the back of the hand. So though the warts has been already cured, but still this patient has history of warts 2 times. And lastly, on one more point which I didn't write it here because there was no such documentation support, but it was my own intuition. That is generally a carcinosin means is a drug which is actually prepared from a cancer tissue, which we all know. So cancer is what? Cancer is something which is developing in our own body from our own body cells. Suddenly the growth or the nature of that cells becomes abnormal, and then the proliferation, and then you know what develops in cancer. So that is basically cancer in a very layman term. And what is happening in an autoimmune disorder? And in autoimmune disorder also the same thing happens. When our own body, when our body cells becomes foreign, becomes unidentified by the T lymphocytes. So a similar situation which arises from our own body cells, just they arise just because of their unidentification by our own immune system cannot identify them. So quite a similar matching up, carcinosin and this autoimmune condition. So I thought it might be very much helpful in this autoimmune situation. The carcinosin like drugs will be very much useful in autoimmune situation. So I went with carcinosin, and you can see immediately after 2 months when the patient came for, there was alopecia. It was persisting. I will not say that it was not persisting, but when you compare with this picture and then this picture, definitely you will get relieved. You can understand that your medicine is now working and it has shown positivity. So I decided to stay with placebo since carcinosin 1 and 2 doses have showing effect now, and hence in the fourth follow-up I went when the patient came in December. Ultimately, the patient was almost cured with alopecia. She's still under my follow-up because, as you know, autoimmune disorders are actually anytime can flare up due to some environmental and genetic conditions. It flares up at times, but till now the hair fall has been well restricted and it's totally under control. Though he's been under some acute medicines due to her acute upper respiratory tract infection problems like cough and cold for the last 2 months, but alopecia areata has been totally been under control. So this is a conclusion which I want to make, that most chronic cases in homeopathy have given successful result after individualized treatment, and especially in autoimmune condition where the patient as a whole is affected. In such conditions, prescription on specific one-sided symptomology may not be infallible. So in this case, for example, you will find there is a complete hair regrowth occurring without any recurrence of bald patches, and it has been documented by photography. This case shows a positive role of homeopathy in treating alopecia areata. However, this is a single case study, and alopecia areata is associated with a variable and unpredictable remissions, which I am saying, and that's why the patient is still under observation. Until now, she is well and good. So, a well-designed clinical trial was an expectation for the homeopathy fraternity side, that the clinical trial must be taken up for a scientific validation of the results, as publications only involve case reports till date. So with this, I come to an end, and thank you all for your patience hearing, and any questions is invited from the audience side. Thank you. Thank you all.
Thank you, Dr. Partha Pratim Pal, Research Officer, Homeopathy, Dr. Anjali Chatterjee, Regional Research Institute, Kolkata, for his nice deliberation and good insight into the topic, Alopecia areata. Now, we are going to a session, question answer session, so that we can clear some doubts maybe remain with us. As I may be add some information in the Dr. Partha Pratim Pal case, that in that case, carcinosin was given. That one point was prominent, that was that take into consideration, and he took it, that is stress. Constant stress were there with the female, with the patient, that act a major role, and along with all the other symptoms. So thank you, Dr. Partha Pratim Pal, for his cognizance and enlightenment. May I now invite query or question from the audience?
Professor Shakhawat, I'm just trying to go through the live chat. It's no questions so far in the live chat. I'll request Kalyani sir to give certain inputs so that in between I'll go on ahead with the searching of any question from the live chat.
Okay. Thank you, Bidyut. First of all, I must thank everybody on screen and out of screen who are enjoying this seminar. And you must agree with me that this today's seminar is a very brief and to the point, and it has been, we all are being helped by this seminar. Special thanks to our inoculator from Sri Lanka, far away from Calcutta. These are blessings, I should say, that alumni from different parts of the world is participating in the CME. Especially Dr. Dilmini, Kaushalya, Gamage for participating and encouraging us, being inaugurator. Moderator, very brilliant professor Muhammad Shakhawat Hossain for nicely moderating the sessions. Special thanks to our brilliant speakers of today. I just like to add few words with the speech of Debajyoti Saha regarding allergic disease. So I'll just share my experience. I had a bad intention since first year in DMS. I had completely no faith on homeopathy till third year of DMS. Always I used to try whether this is a science or a art. So that's why whatever drug I used to study in the class, whenever I get chance among my family members, I used to give them. So one day I found my little brother suddenly started running like anything, shouting, running and scratching throughout the body. Body has become reddened. Very little boy, naked, at the age of about 3.5 years. And that running was as such, he has become suddenly mad. So we tried to catch him already, he is shouting like anything. Fortunately, just before few days, arsenic album was taught to us. And that indented in a mind that if there is any fear, sudden violence, and tossing about, arsenic is a good drug, provided it is not aconite. So immediately I cajoled him hardly with the help of my senior brothers, and I give arsenic 6. And with a surprise, I found within few minutes, gradually, my brother cooled down. Then, by searching, I heard that gram seed, germinated gram seed, 3 or 4 seeds were taken. Immediately, brother becomes so much tossing about and running like an anything you cannot imagine. For that time, it was cured. Again, after a few days, I told you that I did not have faith on homeopathy. Without knowing anybody, I gave him only one seed of germinated gram to him to see what happens. And I find the same picture immediately within few minutes. He started running and shouting. Then my family members told, what you have given? Then I told him that I have given gram seeds. Again gave him arsenic 6. He became cooled down. But unfortunately or fortunately, these incidents happened 3-4 times. Even any curry where gram seeds has been given, he will create same type of reaction all the time. By this time, CPA was taught to us, and I found that to some extent relief, or cannot but to run about for her complaints, is CPA. With some other indications, I prescribed CPA, and since then, he is now about 56 years of old. Never had allergic complaints since then. So as we are learning from this CME, arsenic was one of the good drugs. Constitutional drug is definitely the curative, but many times arsenic 6 may be palliative. Later on, when I analyzed of my own, that I found that RE system, especially T lymphocyte physiology, it is the instigation or activation of RE system, which RE system is under control of some hormones and autoimmune system, which are under control of hypothalamus, which is being controlled by hypothalamo-hypophyseal tract, and which are being controlled by different cortical areas of the brain. So any type of experience from frontal lobe if it goes directly to the hypophyseal tract to hypothalamus, then from hypothalamus to pituitary, and then to throughout the body, immediately immune system gets toned up, start function very fast, and start liberating antibodies against the antigen, specific or non-specific, which you have experienced in early stages of COVID-2. Arsenic gave a very nice result throughout the country. So that's why I have concluded, even after that, whenever I get any such type of sudden reactive phenomenon, including anaphylactic shock, without any special other indication except the fear, restlessness, and thirst for little quantities of water, which is common symptoms of shock, I never forget to give arsenic, and often, mostly I find immediate temporary relief. Then I think for constitutional drug, because these type of allergen reactions are very short lasting, but very severe, tremendous appearance. Immediately we have to control by giving certain drugs. Next, regarding the speech of Dr. Partha Pratim Pal, many of you might be knowing that Partha is one of the very brilliant and promising alumni of Heritage oldest college of India, Calcutta Homeopathy Medical College, and National Institute of Homeopathy. He's a very promising alumni, and he's a very, very good teaching qualities. Voracious reader, I know him very well, and we'll be very happy if he kindly comes to us to give his various type of experiences. We'll be greatly helped by his knowledges, what he has acquired. And at the same time, his proficiency to teachings will gradually be sustained and improved. It is our hardest request, especially from my side. Partha, please come with us, share your experiences and knowledges what you are gathering to help homeopathic system of medicine. So as a whole, by giving thanks to all of you, please try to improve this CME as you experienced today, theoretical knowledge, practical personal experience, literary informations, organon, philosophy, materia, and documentations. Always what I say that unless we document the cases, unless there is clinical verification, unless there is number of cases are getting improvement with the parameters, scientific world is not going to accept, and we will not be able to achieve severe confidence. Anyway, individual cases are definitely good. They are the beginning of research works. We must try to do it. So thank you very much, all of us who are listening and participating in this. Thank you very much, and good night to all of you. Thank you. Bidyut, please.
Thank you so much, sir. Thank you so much, sir. And we are really proud to have our faculty of alumni. We are really blessed. I had written in the personal chat and a brief appeal to all the viewers across the globe who are watching this from National Institute of Homeopathy Alumni Association. Since pandemic, we had started a benevolent fund which our beloved Pralay sir used to appeal to all the alumni. Till date, we have almost over 2,500 alumni from NIH, starting from DIPNH course, BHMS course, and MD courses. It's an earnest request to all the alumni who are watching this and will be watching in future to kindly donate for the benevolent fund, the fund which has been utilized for the alumni in need. We had been able to support few of the alumni whom we had lost during the pandemic or who had been suffering from severe crisis. Though it's a very minuscule amount, but still from drops we can make a big pool. So let's start doing it and request all to have the membership updated. Membership is only 100 rupees per annum. Starting from 2010, the date we had opened our bank account. Our bank details had been there in the description. It has been already displayed in the scroll. However, humble request to all, come forward and donate generously for your own alumni across the globe. Thank you. And thanks all the speakers. And our appeal, as our president sir had already told, that please be a speaker, please be a moderator, be a part of this CME. It's your CME, it's your platform. With this, with permission of Kalyani sir, let's call it a night, and I'll return back to our backstage editor, Orko Mukherjee.
Okay.
Thank you all. Thanks for watching. I hope you have enjoyed this video. And if you liked our IT team support, means if you liked our IT department, we recently got promo. Means our channel got monetized. So that's why if you want to show some support with the IT team too, then please give us some super chat over here. You will get on the live chat screen. Just go there and you will get a money means dollar button. You can click over there and give us some amount of money just to go, support and make this content a more beautiful one. Help us with those, and we will give shout out to those super chats and super stickers over here whenever they comes up. And with that super chat, if you want to give a special question or a special thanks or a suggestion, it will be taken right on that time. It will be getting notified to us too. So with this, again, please do follow us on Telegram. It means please join the Telegram channel, subscribe the Telegram channel, and the link is in the description. Also subscribe our channel. Just click on the red button, red subscribe button, and make it gray, and turn on the notification bell to all, so that you get updated in all the CMEs we update or schedule. And one more thing, follow us on Instagram, Twitter, and Facebook. Like us on Facebook so that you also keep updated with all the CMEs and all the alumni, all the things Alumni Association are doing or the alumnus are doing. So with this, I am also too calling the night. Good night. See you on in our next CME. Until then, it's me or Mukherjee leaving.